people who have used skin bleaching products. You have dyschromias, so your skin color changes, and as it changes and you have hyperpigmentation, people now want to counter that effect and continue to use more and more deleterious things. Then we have sun damage, which plays a key role for us. Sunburn, you have skin infections, you have fragile skin. So your skin is very thin. Wound healing is delayed. When you have operations, sometimes the skin will just literally tear apart. And we see them in the clinics. Our surgery colleagues also, liaise with us because of these side effects. Many times they also would ask the dermatologist to review because they're worried about what's going to happen at the end of the day. On the other side, we have Cushing's syndrome, we have renal impairment, we have immunosuppression, poor wound healing, and scarring, as I've mentioned. So I'm just going to go quickly through some pictures. As you can see, it's what we call exogenous ochronosis as a result of prolonged use of mercury and hydroquinone. You see young ladies. So the lady on the left, you can see she's just starting out, and you can see how it's giving her a hyperpigmented patch. And then she's just going to go on and keep using things, buying things off the market, and it gets worse. On the right, you can see the varied dyspigmentation. You can see the redness, even though in our skin tone, it's a little bit darker. And then you can see striae, the stretch marks, widespread stretch marks. We also have dark knuckles and knees following the use of potent topical corticosteroids, and they're sold in triple action combinations, and they're just available everywhere for everyone to use. Young ladies, teenagers in the higher institutions also using them because of the pigmentation that they get from acne. So this is a problem for us. And you can see the striae stretch marks here. Here again, you can appreciate, the erythema and, the skin discoloration and different colors. The picture on the right is when you have widespread fungal infections. And right now, of importance to us is the fact that they have this widespread tinea. The tinea is fungal infection, and it gives you a geographical distribution. It doesn't look like the normal tinea. It's called tinea umbricata. And recently, we also have tinea indontinae, which is hard to actually diagnose because it uses PCR. So the widespread use of topical corticosteroids is actually contributing towards this. So this is what you can see. You can see the fungal infection. It's atypical. It's larger than normal, and it's quite varied. And this is as a result of the use of potent topical corticosteroids. Then we have acne. So you have a young boy who's got acne, and he goes to use these triple action topical agents that contain steroids. So these are problems that, we see as dermatologists, and you can see the widespread pictures. Now, our colleagues will talk a bit about the children, but you have children. We have fair and white skin teens, the kids and teens version. So look at this young child, and you can see the hair, the fine hair growing on the side, and you can see the pigmentation starting in this young child of 7 years of age, and you can see the effects. So this is what is happening, and this is the extent to which it is going, whereby children, their parents are using skin lightening products for them. We have the knuckles also affected. You can see the hyperpigmentation, and you can see the widespread lightening around the area because of the potent topical corticosteroid use. So it lightens the normal skin, and then the other areas are now made more prominent, and they just keep going on. And we call this the roasted plantain sign. As you can see, it just looks very much like the roasted plantains, and you can see the dark areas. And then it's not limited, like Professor Glover had said, men also are using these products and out there in the sun because of the type of jobs that they do. So I'm just going to round up by mentioning a few of these things that have the impact and implications. We have societal and cultural implications. There's a psychological and emotional impact. There's pressure, there's discrimination, there are emotional consequences. And then education and awareness, the role of education. We need to dispel the myths. We need to work together, the misconceptions about skin bleaching and about the fact that fair skin is better. And then we need to promote a positive body image and self-acceptance. And then we need to have a lot of initiatives that can attack this. And this is what we're doing, by creating more awareness to this very important topic. There are also ethical considerations because, unethical marketing practices are going on, vulnerable populations, and then government regulations, which we'll hear more from one of the panelists. But we need to overview this, and we need to think of enforcement of the laws and the regulations. And, this needs to be consistent. And that is where the problem is. with regulations. So we're advocating for stricter regulations and enforcement and supporting alternative beauty standards. So in conclusion, skin bleaching is a global phenomenon. It has wide, far-reaching consequences. The dermatologists are leading this call. We need to talk about sunscreen. We need to address the underlying societal factors that are driving skin bleaching in Africa, not just Nigeria. And that's why this is very important. And we'll hear from our colleagues to media. We can't do this without media. We can't do this without the regulatory bodies. Thank you very much.
Thank you so much, Ma. That was a very fantastic overview and puts into perspective a lot of the problems that we're facing across Africa today. And I've been to quite a number of conferences and we share similar issues. And that's why we wanted to hear from everyone. And as Prof said, we need to come together and, find solutions to curbing these problems. Because the burden in the clinics, the burden on the health sector is increasingly straining the already strained health system. And so we really need to find solutions to this. And so I'm going to call on next another wonderful mentor and mother figure to me, Professor Fatimata Lee from Senegal. She is a highly esteemed dermatologist and trainer of trainers. And I'll be calling on her to give an overview of skin bleaching in Senegal and also and her experience across Africa. Thank you very much, Professor Fatima, for being here today. Hello, I think you're muted, Prof.
Okay, excuse me, I was muted. Thank you very
Yes.
much for your kind presentation, your kind invitation. I'm very, very happy to be here with all my brother and sister from Africa to speak about our problem in Africa, our regional problem about skin disease. I have 8 minutes to speak about this phenomenon. I will try to do as well as Aisha. Okay, now I
Okay.
want to know what is uh, what is the phototype of this patient? Sometimes when you look patient on back, you don't know if it is a Caucasian or an African descendant. It is very, very difficult sometimes due to the application of cosmetic skin bleaching. And as she say, Aisha, it is all the practice and procedure aimed to altering the natural pigmentation of the skin in order to lighten or even whitening the skin. And the main product to use in sub-Saharan Africa are high potency corticosteroid, most of is propionate of clobetasol, hydroquinone, mercury, and sometimes mixed product manufactured by saleswoman called chemist in Senegal, and of as well as glutathione. These products can be used by topical or intravenous route. And here we have the in rural area, cosmetic skin bleaching products sold over the counter at weekly market in rural area. And here another vendor of skin lightening in the village of Mael, far from more than 600 kilometers from Dakar, the capital. Is it a public health concern? Yes, of course, with high prevalence from 25 to 71% in Africa, associated with various skin disease with a mortality rate of more than 20% for skin cancer associated with cosmetic skin bleaching and high economical impacts. What is the impact of dermatology practice in sub-Saharan Africa and quality of life and sociological? Here we have infectious disease with tinea corporis and associated in the many times with tinea capitis, very widespread lesion in this woman. You have also many localization, inguinal localization of the buttock localization. You have also intertriginous lesion in this woman. In the man, of course, we can have also cosmetic skin bleaching. By example, this man who present this after application of cosmetic topical propionate of clobetasol. You have also tinea versicolor, and the characteristic of tinea versicolor is the atrophic aspect and the achromic aspect, which can lead to misdiagnosis with long treatment without result. Bacterial infection, cellulitis, and erysipelas are very frequent in our context. And in this multicentric study, we show that the cosmetic skin bleaching is associated, is a risk factor of erysipelas and cellulitis. Many localization, the most common is on the leg, but you can have also on the arm and the buttock. Leprosy can be masqueraded by topical corticosteroid used as cosmetic purpose. Here, lepromatous leprosy masqueraded by corticosteroid with involvement of nerve involvement and many complications. You have here another case of leprosy modified by topical corticosteroid. And here another case where the patient was treated for a long time for tinea corporis. Scabies is very common in patients using corticosteroid. We have more than 100 lesions and the hyperpigmentation, post-inflammatory hyperpigmentation in this case, and sometimes a crusted variant of corticosteroid. Viral infection is more and more described. By example, this woman who have pemphigus bulloid associated with cosmetic skin bleaching and who present infection by cytomegalovirus herpes. And another case here of HHV6 and Epstein-Barr virus herpes infection in the patient who use cosmetic skin bleaching. But the more concern is the skin cancer. Skin cancer now, we have more than 70 cases of squamous cell carcinoma with a mean age of 57 and sometimes associated with other complications like diabetes and high blood pressure. Many aspects, cauliflower lesion here on the sternal area, with dermoscopy confirmation and many other localization on the neck, on the back, and with a bad prognosis, because most of the women have dead after metastasis occurring. You have these cases on the neck, on the back, here on the neck. The 3 patients are died, unfortunately, because the lack of treatment, the lesions are very, very large. And recurrence is common also. Recurrence is common on the second SCC appeared in the neck, back, and face. And we have a high mortality. About the other skin disease, we have acne. Acne is particular because it is initiation and the hyperpigmentation. Trying to treat hyperpigmentation is a vicious circle of application of cosmetic skin bleaching. You have here some cases, and in the most cases, you have folliculitis, BDN folliculitis, which complicated the acne treatment. Rosacea, corticos-induced rosacea is also common with dermoscopic aspect, very well recognized. Pigmentary disorders like ochronosis, of course, but sometimes pseudolupus or pseudo-lichen skin diseases. You have here ochronosis, not only on the face, but also on the hand and on the feet. On the hand here with dermoscopic aspect, sometimes associated with pseudo-lichenoid dermatosis and rosacea, many diseases in the same patient. Another case here, and another case of lichen-like lesion, and here lichen-like associated with cosmetic skin bleaching. Periorbital hyperpigmentation is common also, as well as caustic dermatitis, and in sometimes granuloma associated with cosmetic skin bleaching. And reticulated dermatitis is very common in the patient who use cosmetic skin bleaching. What about trophic disorder? You have atrophy and poikiloderma, and also caustic dermatitis, and also stria, very, very common. And the caustic lesion with some particular aspects. Dermatosis papilosa nigra is associated with the use of cosmetic skin bleaching, and you have skin aging is also another concern. Here, when we compare two patients with skin or without skin bleaching, you see premature skin aging. Lyell syndrome is also very frequent associated with glutathione. Not very frequent, but is also described. The skin disease associated with cosmetic skin bleaching are disfiguring, contagious, killing, and altering the quality of life. As the organ involvement is also possible, endocrine, metabolic, cardiovascular, psychiatric, gynecologic, ophthalmologic, renal, and neurologic, with many studies to confirm this. And recently, endocrine complication was also described, and ocular lesion like ochronosis and psychiatric comorbidity also. You have ophthalmologic lesion in patients with exogenous ochronosis, and the ecotoxicity is also very common with the mercury in the product. And finally, the socio-economical impact and the product selling is account from 19 families' income. And you have here the role of the social media and influencer in the era of digital beauty. The motivation are very variable, and in some study, we show some conclusion like the fashion trend, the desire of beauty, the mimicry, and the self-medication. The management have many pillars. First of all, counseling, no stigmatization, to adopt the good practice, the skincare routine, and the global approach for the comorbidities. The prevention is linked with self-esteem, information, education, the role of the government, the legislation, and the treatment of complication. Now, what about the action? We have Association AIDA since 2002 is inform the population about the complication of the skin bleaching. And recently, the position statement with ILDS. Thank you, NCOSA, for this. And for WHO, we have no concrete action for the prevention of this cosmetic skin bleaching. Finally, cosmetic skin bleaching is a public health concern with a high impact in medical practice, particularly in dermatology, with mortality in 3 situations: infection, 10, and a squamous cell carcinoma. The morbidities is linked to the skin disease and other general condition. The quality of life is very altered with stigmatization, and we have an inequity because most of the patients are female gender. We have also an impact on ecology and economic, and we need to have a psychosocial approach for to fight against this practice. But unfortunately, we have the lack of government, regional, and international measure sanitary, and we call for action. Thank you very much for your attention.
Thank you very much, Prof. Fatima. That was wonderful and also very concerning. Some of the pictures are very grave, but these are the things that we are seeing in our clinics these days that are making us to raise alarm about this problem of skin bleaching and the negative effects of this condition, of this practice are, seem to be becoming more and more severe, based on, the kind of products that are being used, the concentration of some of these lightening agents that's being used, because the people making these products have no idea of the safety of the products and the possible harm that they can cause. So we really need to have, multi-sectoral approach, which is what we're trying to push for as in this webinar. And so I would like to now call on another wonderful teacher and role model from the Republic of Tanzania, and he's the principal of the Regional Dermatology Training Center in Tanzania. It's Professor Daudi Mavura, wonderful teacher and mentor to and teacher to many of my colleagues across Africa, especially East Africa. And so we'd love to hear from you, sir, about what the landscape in Tanzania is as regards skin bleaching. Thank you very much, Professor Daudi, for being with us today.
Yes, very much. Good afternoon, everybody. It is a great pleasure to be part of this webinar today. And since I have 4 minutes, 5 minutes, according to the instruction I receive, I'll try to be as uh, practical as possible. So today I'll talk about current skin lightening product in Tanzania, whereby I will touch on prevalence, imaging trends, and impact on dermatological disease burden. So, as we are all aware now, skin lightening has increased dramatically over the past 3 decades. Africa being the one with the highest rate of cosmetic skin bleaching worldwide, with a range nearly to 30% in East Africa. And as we have heard other speakers previously, that we're ranging in the same type of agents that we see mostly is hydroquinone, corticosteroid, mercury, kojic acid, and glutamine. And this really bring a number of complications ranging from ochronosis, steroid acne, atrophy, infection, nephrotoxicity, and as reaching to cancer, as Dr. Professor Fatima have just illustrated in her presentation. So why these things are not well controlled in Tanzania? Why are we having harmful products still available? In Tanzania, we have a body which is called TMDA. This is Tanzania Medical Drug Authority, which is responsible for regulating all these cosmetic products before they come in our country to make sure that they are safe. So in their act in 23, they prohibited importation and distribution of blame bleaching ingredients like hydrocortisone containing cosmetic product, mercury containing product. All these were prohibited. However, current market observation shows that there's increased availability, there's online sale, there's informal importation, there's repackaging products, there's products without ingredient disclosure, and there's social marketing, which have dramatically increased over the years. And why this? There's a weak regulation in this, and there's a struggle in regulation and current product which are entering in Tanzania. We've seen that there's weak market surveillance with this body. There's a cross-border importation whereby there's a special people between borders like Tanzania and Malawi. If you go to Mbeya, you find there's a special border who transport these goods from one country to another, and it's very difficult to catch them. There's information of cosmetic business which have increasing dramatically through social media and all that. There's poor labeling of this product. There's limited consumer awareness whereby they only focus on the photos which they see in those products, and very difficult to judge whether these products are good or not. Now, I will touch on the trend and the impact on this dermatological disease burden in Tanzania. But before that, if we look at demographic and commercial landscape, has fundamental shift. If you look at historically, that long time demographically, we used to see that those who were using this product were mainly older women. But the modern epidemic now, you see patients are younger. These are young, 17 years old, and increasing number. And unfortunately, to us, we're seeing more men are now dwelling in this, as contrary to what Dr. Fatma said, that there are more women. So geographical, it used to be diffuse, hidden practice, but nowadays, strong urban predominant in this practice. And you see the application, if you look at application, also basic topical cream were used historically. But nowadays, there's advanced systemic intravenous, IV drip, chemical peeling, and all that. And what is the motivation? Why are they using these cosmetics? You see, long time, historically, it was correction of specific blemish. But now there's a desire of immediate cosmetic result and a full board alteration. So it's really a new community practice driving skin lightening, whereby this, as I said, this social media, Instagram, TikTok, Facebook, WhatsApp business are really influencing our young generation to use this skin lightening, whereby they usually don't give the really message. What they portray to them is that your skin will glow, you will be brightening, glass skin, whitening, toning, rather than bleaching. So many of our users, they don't really see what is the end product. But I will touch on few studies which have been done at our center, whereby one of our colleagues, Dr. Eli and Sangi at Muimbili National Hospital, they conducted a study in skin lightening practice and cutaneous effect among women in Kinondoni municipality in Dar es Salaam, whereby they observe prevalence over 54.5%, and commonly used product were kojic acid, which was 50%, and hydroquinone. So they were high among front desk workers and petty traders, whereby they didn't know exactly what they are selling, and people will buy because of the promotion that they found. But majority, about 82% of women practicing skin lightening for beautification purpose, and only that. They wanted to look, to glow, to have a nice skin, is what they say, that a white skin is good. I am not sure about it. But also at RDTC, with our senior resident, Dr. Nancy, conducted a study to see the cosmetic use and its effect, the prevalence, the clinical spectrum, and the associated factor among female college studying at our university, at KCMC University. And whereby she found that 46.5 of the students were using this product. Almost half of the products did not disclose what exactly was the product ingredient. And most common ingredients were kojic acid, glutamine, vitamin C, hydroquinone, and betamethasone. So what we see today is what began as a cosmetic practice is now becoming a dermatologic public health challenge, because we see a major shift in clinical presentation as a young people ranging from 17 years in dwelling in this lightening product. Increasing number in men and urban predominant. And then we have now patient waiting immediate cosmetic result, and this is really a challenge, and we have to see exactly how do we do this. Because if you look at aesthetic clinic, there's rapid expansion of beauty clinic, cosmetic spas, medical spas. Services increased, offered IV glutamine, glutathione injection, chemical peel, whitening drip, bleaching cream. And this really is becoming a problem when we look at this. And the challenge is there's a variable of training which are going on. There's a lack of regulation and license certificate of these spas which are using this. There's a cosmetic consultation replacing medical dermatology. And this replacement is a major imaging public concern, which we really have to look at it. So the take-home message here, I will say that the skin lightening in Tanzania is no longer simply a cosmetic issue. It is becoming a major public problem in a public age, which is around youth. And the regulatory challenge is failing to control this. And social media have taken charge, and everybody in social media and doing as a routine skin care, as using more than 1, 2, 3 products. So dermatologists are increasingly managing preventable complication arising from unsafe cosmetic practice. Without strong regulation, public education, and multidisciplinary collaboration, the burden will continue to rise, and I'm afraid that we might not be able to control this. Thank you very much. Thank you very much.
Thank you so much, Professor Daudi Mabura. That was really, really very insightful. And it just seems like it's across the continent we're having the same challenges with regulation, with the social media, and people giving false marketing, claims that are not actually true. So we really need to have beyond just the clinics, dermatology clinics. And that's why we have a lot of our public health physicians here with us so that they can hear from us as well about the burden of this practice, that what it's causing in the society across Africa. And so I'd like to find the last dermatology presentation would be, we have two more a bit, from Professor Celestine Ahogo, who is a wonderful dermatologist and professor from Cote d'Ivoire. I'm very happy that he's, here with us today, and we would like to hear from him, especially as a lot of our products also, they, Nigeria and Cote d'Ivoire are places where they manufacture a lot of the lightning products, and I'm sure they also have their challenges. So Professor Celestine, thank you so much, and we would like to hear from you before we speak to the pediatricians, because this lightning craze has gotten to our innocent children, and I'm sure the pediatricians too have, some insights for us as well. So Professor Hugo, sir.
Hi, everybody. Do you see my screen?
Yes, we can see your screen. Maybe you can put it on the slide share mode, the other mode.
What is the?
Yes.
Okay, thank you. Thank you very much. I'm very happy. It's a pleasure and an honor for me to be part of this meeting. My topic is about skin bleaching in Cote d'Ivoire. I have 4 minutes to discuss with you the consequences of skin bleaching in Cote d'Ivoire. It is difficult, but I will manage. As we know, skin bleaching is a public health problem in many countries in sub-Saharan Africa with multiple consequences. In Cote d'Ivoire, the local name of this skin lightening is chacho. That is the local name. Prevalence varies between 30 to 60%, according to several studies. More than half of the people have a good level of education and a good social condition. And when you ask the main reason for why they practice skin bleaching is to improve their skin tone. There are other reasons, but the main is to improve their skin tone. As we have always said, many products are used as soap, ointment, lotion, and there are many depigmenting agents used also in Côte d'Ivoire, as hydroquinone, topical corticosteroids, vitamin C, etc. And most of the time, the duration of the use vary to 1 year to 10 years. Concerning the supply location, skin bleaching in Côte d'Ivoire, many times it is on the traditional markets. But what we notice is that also there are also increasingly social networks which are part of this skin bleaching. Concerning skin complication, we also notice the classic complication has acne, but we also see in our context generalized fungal infection has tinea corporis, as we see on this slide. And this complication and this skin bleaching is also practiced by men, as we see, with generalized fungal infection, as we see on this photography. But also we notice exogenous ochronosis and some large stretch mark associated with exogenous ochronosis, as we see. One of the most frequent complications in our context is bacterial infection, as bacterial epidermitis, as we see, but also in Côte d'Ivoire, 2 cases of squamous cell carcinoma have also been reported. It is not enough as another country as Senegal. But what we notice also is that skin bleaching is also beginning to be observed in the pediatric population. And most of the time for several reasons, including aesthetics and post-inflammatory hypopigmentation, as after prurigo, for instance. That is for all these reasons that the Ivorian Society of Dermatology continues its work educating patients, continue training dermatologists in the management of the consequences of skin bleaching, and is attempting to create a thematic group on skin bleaching to continue fighting against this public health problem. Thank you for your attention.
Thank you very much, Professor Ahogo. Professor Celestine Ahogo, thank you very much, sir. This was very insightful and shows that across, Africa, we're having the same challenges, and the dermatologists are feeling the burden in our clinics, and that's why we are having these conversations and also involving all our colleagues from public health, from psychiatry, from regulatory organizations and pharmacists, because we need to find, solutions. We need to pay attention to this because it's putting a lot of strain on our health systems. Now, I would like to call on our 2 pediatricians. We have Dr. Ayodele Rena, who is a wonderful pediatrician, the noisy Niger pediatrician on social media, and doing great work with advocating for healthy practices, for children. He calls them his constituency members. And so he's here because we want him to take this message back to all the people online who, he's able to impact and influence, and also share with us his experiences with this problem of skin bleaching for children, which is really alarming. So please, let's welcome Dr. Ayodele Rena to say a few things. We are running a bit behind time, so if we can just keep it short and simple. Thank you so much, Doc.
Yes, brilliant. Thank you so very much, Dr. Cole. Can you hear me?
Yes, we can hear you very well.
Yes, thank you so much. All right, so just a few words on skin bleaching in children. I do find that, as all the other brilliant presenters have said, it is on the rise in children. And of course, this comes from a position of everybody wanting to be lighter skinned. I think everybody wants Professor King waist color for their children. And I think a lot of mothers that I speak with tend to say that, oh, but my baby, when I gave birth to my baby was lighter skinned. My baby was a bit more light skinned than this. So how come my baby is now dark? And I say to them that, yes, most babies, they're coming in from, the womb that had no exposure to sunlight, the skin pigmentation is not as pronounced. And later they actually go and fall into their actual skin color. And I say to them that, but you are kind of dark and so is your husband. So how are you expecting your child to be light skinned? But anyway, what they now do is that they turn to triple action creams and they mix that into the regular skincare moisturizer of their children. And you find out that this, of course, has the risk of making the skin thinner, exposes them to an increased risk of other types of skin infections like bacterial skin infections and then impetigo. So I find out that those are the reasons and those are the things that a lot of mothers do. But on the more long term, the problem is that I end up not seeing those children on the more long term basis. So if they are mixing steroids into the creams or bleaching agents into the regular creams of the children, by the time they are being seen, they're probably being seen with kidney disease, liver disease, mercury poisoning, hormonal disruptions, growth failure, as well as maybe precocious puberty by the endocrinologists. And so, because it's such a long-term problem, I might not, as a general pediatrician, seeing them see the outcomes, but the outcomes become a little bit more obvious when they begin to reach school age or even towards the second decade, when the endocrinologist might see all these hormonal issues. So I'd say that the message really needs to go out to let people know that at the end of the day, mixing bleaching agents or even triple therapy creams into children's creams to lighten their skin is not a practice that we recommend. It's something that we should actually actively discourage. And I think we can take this message out and let people know that this is something that has long-term consequences for the child's general outlook in terms of their health and well-being.
Wow, thank you so much. That's really concerning. And, we really need to, as you just mentioned, that it's down the line, we're going to have to involve several specialties. And so we just need to take this message out to all the other specialties and endocrinologists, ask for skincare recommendations. You're rightly so, because I know of a case of a child who had growth plate failure on one of his legs, as a result of shea butter and triple action creams, and one leg was growing, the other wasn't. And they discovered that the underlying problem was due to the steroid creams that the mother had been using from when he was really young. And it was quite a very strange case. So we really need to just continue to sound the alarm so that people can be aware. And then hopefully everyone can put more pressure on our regulatory organizations to try to curb the availability of some of these products. Thank you very much, Dr. Rena. Please help us share this message to your constituency members and their parents, please, as much
very
as we
briefly,
can.
Dr. Cole. So I really Dr.
Yes.
Agbola is here as well, and maybe she can just contribute to that as well. I don't know if triple therapy creams. I know that they're over the counter here, and is that what happens elsewhere? Actually, that triple therapy creams are over the counter, or is it only Nigerians that make triple therapy creams? Just please enlighten me. And should it be on prescription only rather than over the counter the way we have it in Nigeria?
Please, Dr. Agbola, Dr. Florence Agbola, who is also a pediatrician on the panel. We'd also love to hear from you. I want to believe that the steroid creams are widely available across Africa. Most countries, you can get them over the counter, which is not meant to be so. So it's kind of a regional problem in Africa and I think in Asia as well. So that's the challenge. Dr. Agbala, I would like to hear from you. What are the cases that you see as a pediatric dermatologist that may be related to skin bleaching, if you can say one or two words?
Thank you very much, Dr. Cole. Good afternoon, everyone. Yes, I agree with Dr. Rena. The skin bleaching incidence is actually directly or indirectly affecting children. Directly, more of adolescents and caregivers who apply these food products on their infants, and indirectly, transplacental transfer to fetus and pregnant women, exposure to breastfeeding, and even accidental ingestion of these harmful products by toddlers and infants. So it's really, really a major problem. I'm not going to repeat what other people have said, but from my experience, I have noticed that in fact, when they come to me and their problem is not actually dermatology, according to them, or they come with a separate problem, and I actively look out for this. Of course, routine, you want to get a history of their routine skincare products. You discover some of these things and you use that opportunity to educate them. So the truth is that public awareness and education about this topic is very poor. You'll be amazed, even educated people, so-called educated people. So I think we need to do a lot of awareness. And of course, as pediatricians, advocacy is major. And stricter regulations. It is wrong. I think there should be a ban on someone marketing skin bleaching products to minors. So we have a very free social media marketing, and it's not helping the situation at all. So there should be stricter measures. There should be stricter measures and penalties for illegal manufacturers too, and even distributors. And I think social media, the media generally, not just the Facebook or Instagram, should do more advocacy. Also, training and retraining of healthcare workers. One of the major things I did when I started the pediatric dermatology clinic is to, I think about a session with some of the doctors. And one of the things I said, when you see children with skin problems, please do not prescribe triple regimen therapies. Do not prescribe topical steroids. So I think training and retraining of healthcare workers too will go a long way in helping us. Thank you.
Thank you very much, Dr. Agbola. That is very insightful. And yes, actually, a lot of, in addition to people using it for skin lightening, quite often we have frontline health workers recommending triple action creams to babies, to children, and we really need to have some training and discussion. In children, we don't need potent steroids. Usually we start with the least potent if needed, and then we can gradually move up rather than starting from right up there with clobetasol, which is the most triple action cream. So we don't recommend them for children, and we hope we had a health worker training over the weekend and we emphasize this once again. And so we'll just keep putting the message out there. I would love us to now go to our public health experts. As you can see, I hope we have been able to make a case to our public health experts that this is now beyond just the dermatologist. It's a multi-systemic, multi-specialty concern, and it's a public health concern. And so we'd like to call on Professor Tolu Olufunlayo, who is a consultant community health physician and also associate professor at the College of Medicine, University of Lagos. And we'd love to hear from her. We have a question and say what kind of, now from what you've heard, what public health interventions do you think can be helpful to curb this problem of skin bleaching? because it goes beyond just cosmetics now. We've seen all the terrifying pictures, which is what we have to deal with. And then beyond that, the systemic implications. What can we do, to begin to, have public health interventions for these practices? Thank you, ma'am.
Good afternoon, Dr. Cole-Adeife, fellow panelists, and all our audience. Thank you for this opportunity. For me, I think quite a lot of the solutions have already been mentioned in passing. We need to intervene at the policy level, at the community level, at the clinical level, and at the media as well. They all play a huge role. But I think I want to start from the media, from the intersectoral aspect. Like has been alluded to by some of the previous speakers, there's a lot going on in that space, and there has to be an aggressive counter movement on social media and on the media. One of the things that came to me when I was asked to speak here is the typifications we see in movies, in songs. The ladies are always fair, light skin. They have a persona, and that has to be changed. So we have to work with the media sector, with Nollywood, with the music sector, to also let them know that they need to change that picture. Healthy skin is not necessarily light skin. Be proud of the skin you have. So that's one thing, because I read an interview in the paper over the weekend, which you contributed to, where people were asked why they bleach. And they said, well, even though they know it has health consequences, the fact that it's going to get them down the road, it's going to get them to what they want to do, overrides the health consequences. And so we need to begin to change that. So the next thing is at the community level, catch them young. What can we put in the curriculum at school, maybe late primary or early secondary school, to let young people know before they get to the age where they start using these products, that it's not good to bleach, and these are some of the things that can happen. Then we can change it from the bottom up. So we need to look at that as well, talk to teachers, and then we go to the health facilities. We know that dermatologists are few and far between. So we're really happy that we have this ensuing partnership between the dermatologists and public health physicians, amongst other specialists. So we need to train health workers at the grassroots, like you've been doing already. We need to train more to recognize, to give health education, first of all, about the dangers of, skin lightening, but also to recognize early signs of skin bleaching and to be able to counsel people. And sometimes the consequences of bleaching show up at PHC and it's just, overlooked. For example, a wound that is not healing, or repeated skin infections. Those are the kind of things that need to get flagged up quickly for more attention. Then at the level of policies and market surveillance, that's a difficult one. It's just like what's happening in the alcohol sector, for example. However, we need to keep at it. We need to just keep at it, work with the regulatory bodies such as NAFDAC, to regulate the ones that are on the counter. Then those that are, there's a hidden industry, very large industry of those hidden ones. And those are the ones that are most difficult because they have the very, harsh compositions like the chemical peeling and so on that has been mentioned earlier. Many of those ones are not even on the radar of NAFDAC at all. But we need to work with these regulatory agencies. We need to work with different stakeholder bodies, have frank conversations. And then the place of research is also another aspect that public health can really contribute to. We need to ask ourselves, ask the people, why do you do this practice, even though you know it might cost you your life or cost you something later down the road? So that's behavioral research. So these are some of the areas I think that public health really can contribute to this public health problem of skin lightening. Thank you, and over.
Thank you so much. Thank you very much, Prof. And this has been at the heart of a lot of us dermatologists lately and that's why we were on Balogun Market, on the streets of Balogun and on the streets of Mushi over the weekend. And we would like to partner with our public health physicians to have a wider reach, because as you said, we are very few. And so we would like people to have this message and go with it whenever their outreach is, in addition to screening for blood pressure, sugar. We can also advise on skin health practices. I was in Ekwe for an outreach with CALSO, the Lagos State of the Lagos State Wives Association, and honestly, I was astounded by the number of adults and children who had features of skin bleaching in a far place like Ekwe. So in outreaches, I think it will also be a great opportunity to educate people about, this. Thank you, Ma. And now I'd like to call on my dear sister. She is the Senior Special Assistant to the Governor of Lagos State on Health. Her name is Dr. Tony Adeyemi, and she's a wonderful public health physician, always on radio, on television, advocating for various health conditions, and working closely to improve the health indices in our state and in as a whole. And so we'd like to hear from her as well and ask how the government can come in. Most people don't think of skin when it comes to health. They think, oh, skin is not important. But I think for anyone watching this webinar will see that skin problems can be quite extensive. And now that we're having cases of skin cancer and mortalities and then increasing cardiometabolic conditions, we need to take this problem seriously. So, Dr. Tony, please, I think, yes, you're here. I don't know if you can put on your mic and say one or two words. So we'd like to know how, the question is basically how we can get the government in on skin health. Recently, the World Health Assembly passed a resolution saying skin health is a global public health priority, recognizing it as a global public health priority because of the number of people with skin health conditions. And so we would like to also, have a bit of priority as well with government programs for public health. And we don't know what you think about this and, how we can come in. So especially as regards to the skin bleaching crisis. So are you there, Ma?
Yes,
Hello,
yes.
Dr.
Good afternoon.
Yes,
Good afternoon, Dr. Cole-Adeife.
good
Good
afternoon.
afternoon, everyone. Thank you for having me. Huge apologies. I'm unable to turn on my video because I'm having some issues with my internet. So I just have to really manage the little network that I have. Thank you very much. I think this is a very important topic. And as to the role of government, how government policies, how we think government policies the role we think they can play in discouraging skin bleaching. I think policies can actually go a very long way beyond just regulation because policies create an environment that would enable people to actually make healthy choices. And if we come from the public health perspective, if you look at it in terms of prevention, how we want to prevent the skin bleaching, first of all, yes, regulations should actually exist. Governments, what we can do is to strengthen the regulation and the enforcement of law restricting the manufacture, the importation, advertising, and even the sale of these harmful skin bleaching products. But beyond regulation, I know primary health care is a way to easily get through to the people. So if we can sustain our public education, like today's Skin Health Day, or today that we are using this program to commemorate Skin Health Day, if we could have included people from our primary healthcare centers, because they're also the ones that would be able to counsel some of the people at the grassroots. Also, they are the ones that would first of all detect the early signs when complications have started setting in, so that they don't come to our teaching hospital at a very, very bad state. So that's the early detection and promotion. However, health education, I would still like to stay on health education because I think that's very important. We need to like see how we can integrate this in information that we are passing right from our schools. So even so, it's a collaboration. It's not just health. Health has to collaborate with education. We have to collaborate with commerce and industry, and then other ministries as well, to ensure that we're working hand in hand, and from the very basic, from the very basic level, which is the educational level, people are being aware that a healthy skin is preferable over a lighter skin, for example. So so in summary, we need to integrate our skin health into primary health care, into our primary healthcare structure, so that our health workers, not like we're saying that, because we don't even have enough dermatologists in Nigeria, that we have to have dermatologists at the primary healthcare level, but our healthcare workers can undergo trainings, basic training, so that they are able to identify some of these things, and more importantly, educate the public, because they are usually our instruments. We use them for a lot of health education and health promotion activities. So they are able to educate the public. They are also able to refer appropriately. And then finally, it's not a challenge of the healthcare sector alone, as I've said. It requires the whole of government. So we need to work with people in education, people in trade, people in customs. Lagos has LASCOPA. I don't know if we are aware. That's the Lagos State Consumer Protection Agency. So LASCOPA also works in the interest of consumers. So they can actually help enforce some of these legislations that are already in place. So like, for example, if we have some products that have already been maybe banned and we are still finding them on the shelves of supermarkets, they can actually go in and enforce some of their duties as well. So government policy, it's not only to restrict the harmful products, but to create an environment where people value the color of their skin. We're changing the language, we're changing the narrative and all that. So in future, I mean, working ahead and then collaborating with the Dermatology Society, I'm thinking that if we can work hand in hand, apart from the outreaches outdoor, even in our healthcare facilities, let's bring every other person up to speed on how to properly health educate, because when a doctor is consulting and then seeing a patient, he can already tell, he should be able to identify someone that is already having maybe the dark knuckles and all those telltale signs of skin bleaching, and able to, not just to ignore, but to counsel immediately and then promote more a healthy skin. So in closing, the most effective policy that we can have as government is one that combines regulation with everybody. Education, very important, because we need to catch them young. And then we need to also back up our enforcement with empowerment and legislation, so that we can have a lasting behavioral change, because attitude of a person is very hard to actually change. So we actually need to start at the basics. Thank you very much.
Thank you very much, Dr. Tony Adeyemi. We're so happy that you are here, and we hope that we can work more closely with our public health physicians, with the government in terms of in terms of public health outreaches and programs. I know we do a lot across the country, across Africa, but most of the time, skin health is usually, not considered with such interventions. But we are here hoping that now that we've shown the extent of the problem, that skin health can be included as part of trainings and screenings for public health and primary care programs. Thank you very much for that insightful contribution. And so now I would like to call on our pharmacist. We have two pharmacists in the house. Excuse me, Pharmacist Olarewaju. I don't know if you can put up your hand, but Pharmacist Madehi, who is representing the Pharmaceutical Society of Nigeria, Pharmacist Gafar Madehi, please, we would like to hear from you. The challenge we have with the pharmacies is the availability of the triple action creams, which a lot of pharmacies you do have. And, people come and buy them both for cosmetic purposes and for treatment, even for their children. Is it possible that there can be some kind of agreement to maybe not have, people do not have access to those potent steroids without a proper prescription? And how do you think this can work to try and restrict the access of these fixed combination creams with potent topical corticosteroids that is one of the most common ways in which people bleach their skin? I mean, you see people mixing these different creams online into shea butter and to other products. And so we'd like to know what your thoughts are about this, given that we can see a lot of the adverse effects of these steroid creams. Over to you, sir.
Thank you very much for inviting me to this discussion. And I've been part of this discussion from onset from 2 o'clock, and I listened to all the presentations, and they are quite educative and revealing. Yes, but I will try as much as possible to restrict myself to your question on the availability of triple action creams in pharmacies. Well, as you all know that the distribution of triple action creams or cosmetics that contains corticosteroids is not. I mean, it's one of the byproduct or one of the consequences of not, I mean, of chaotic, if I can use that word, chaotic distribution system of medications in Nigeria. Because as much as pharmacies, will on their own want to restrict access of triple action creams to prescriptions, there are so many other sources, I mean, other outlets where the public, get these products. And from what is on record, that there are over 3 million unregistered premises in Nigeria that are into distribution of drugs, unregistered premises. So compared to less than 100,000 of registered ones. So we can now see the enormity of that problem. So I think that the regulatory agencies like NAFDAC, for example, because NAFDAC they are the ones that are actually in charge of distribution and production of regulating the distribution and the production of these products. Coupled with Pharmacy Council of Nigeria, that is involved in the registration of premises where these products are obtained. We should not mix these two functions together. We should not mix it. PCN is in charge of the premises where you can obtain medications, while NAFDAC is about distribution, and the registration of the products. So, and just like I said, the regulatory agencies, NAFDAC and PCN, are overwhelmed by these problems, because of lack of adequate manpower and the rest, for them to tackle this problem. Based on what I just told you, there are over 3 million unregistered medicine outlets in Nigeria. So now I think that where we need to really focus on, it has been said severally, is on the users themselves, because even if which I know most of my colleagues, when we receive demand, for this product, we as much as we are concerned as professionals, we educate this public, on the danger, of exposing themselves to these steroids, and but you can now the situation whereby they go to unregistered outlets to obtain these products, and most times when we educate them, they will even ease at us and leave, and and many of them will even go and get the product somewhere else and come and show us, see what you are preventing me from getting, so I've gotten it somewhere else, so we need to focus more on the public campaign, and especially which was mentioned, the social factor, colorism, where lighter skin, tones are, are more privileged. If you look at employers, when they are employing, people that will go into marketing and things like that, when they see lighter skin ladies, they are more, already they are already biased, in taking those ones to do their marketing for them, So, we need to look at all this, and again, the advertisement, has to also be addressed, because you still see billboards where you see them, advertising these creams with a lighter skin lady and, associating with beauty and things like that. So these are the things that influence use of these products. So in summary, the regulatory agencies cannot do this alone. There is need for serious public awareness, on the effect, of using these triple action creams. Then again, I want to be factual with you. We receive prescriptions, from prescribers prescribing these triple action creams. It may not necessarily be dermatologists, so but you have general practitioners, prescribing these triple action creams, to take care of some minor skin issues and things like that, So, and when there is demand, definitely, that is where supply will move towards, So if all these areas are checked, I believe we have a better control of the access to these products, these cosmetics, and in the area of regulation, there is generally a very thin line, between or I can say cosmetics generally, they it's very difficult to position cosmetics as a regulated product, compared to drugs. And even though we know that these cosmetics, by looking at their content, they are drugs, but because they are labeled as cosmetics, the regulation is lighter, because they're already labeled as cosmetics. And this kind of, confuses the public and even the regulators themselves, because you still see these so-called cosmetic triple action creams in supermarkets. And the law is very clear, that drugs should only be available in registered premises. But because these products are labeled cosmetics, you find them in supermarkets. And ordinarily, regulatory agencies, they will not even bother themselves to go there. So these are the areas that I
But
feel
sir,
on my own
can
point that we
can
need to look at. Thank you.
clobetasol be can something containing clobetasol propionic be classified as a cosmetic? Shouldn't that be
It shouldn't be. It shouldn't
and
be.
medication.
But yeah, it should be. It shouldn't be. It shouldn't be. You know. So and that is the way it is. It shouldn't be. But you still see this Damovate, which is a brand of clobetasol cream and some other triple action cream that contain clobetasol. You see them in supermarkets, in openly displayed, and even in the general market where they are selling cosmetics. They are there in form of lotion, creams, and different dosage forms. You know, so
Mhm.
that is the issue, and they will tell
Issue.
you, we are selling cosmetics, not knowing that they are selling drugs. You know, so and
So I
regulatory
think we
bodies,
need to,
they
yes,
are-
we
they
need to
hardly go to
engage
those
with them.
areas. Exactly, exactly,
Yes,
exactly.
we need
So
to
there is a
engage with them.
need, you know, and
Yes,
strengthen
absolutely.
and send and also strengthen regulation of cosmetics. You know,
Yes.
because there is this
Thank you
wrong
for that.
perception that cosmetics are not drugs. There is
Drugs.
that wrong perception, you know. So that
Yes.
is
Thank you so much, sir.
yeah. Thank
And
you so
just
much. Yeah.
and just riding on that exactly, I'm very happy that we have pharmacist Sholabomi Olarewaju. She's for the state here a cosmetic safety focal person. So we would like her to talk about this. And we have this challenge where there sometimes is a gray area. Pharmacist Olarewaju, are you here, please? Yes, I think you're here as a panelist. There's sometimes a gray area between the cosmetics and the medication, as pharmacist Made here has mentioned. And we need to be able to, get rid of that gray area so people are not selling potent topical corticosteroids as cosmetics and, causing a lot of harm, as you must have seen some of the presentations of the challenges that we're facing now with some of these products. But we would like to hear from you. And no, I know there was a program recently to manage there's an upcoming policy on cosmetics. I would like to hear from you. I know that there is work going on, and I think it's something that can be replicated, not just Lagos, Nigeria, but across Africa, because the problems are the same all over the continent. So please let's hear from you, Ma.
Good afternoon, Dr. Cole and other members of the panel. I'm glad to be here. So, following the adoption of the National Policy on Cosmetic Safety and Health, I hope I'm being heard.
Yes, we can hear you. Thank you.
Okay. So, following the adoption of the National Policy on Cosmetic Safety and Health at the federal level, in Lagos State, there was a state engagement by the Federal Ministry of Health and Social Welfare in collaboration with the Lagos State Ministry of Health. There was a state engagement that was convened. So the purpose was to support the domestication of this national policy and its implementation plan. So there was sensitization of key stakeholders on the provisions of the policy in Lagos State. There was an assessment of the cosmetic safety landscape in Lagos State and to promote coordinated stakeholder participation in the implementation of the policy. So what happened was that we had participants from different areas. We had from the Lagos State Ministry of Health. We had from ministry, departments and agencies that were relevant government ministries, departments and agencies. We also had representatives from the academia. We had representatives from Cosmetic Manufacturers and Dealers Association. We had from research institutes, professional bodies, regulatory bodies. So everybody were, present in this state engagement. And the Lagos, they were to assess, the cosmetic safety landscape of Lagos State. So the regulatory challenges affecting the cosmetic sector in Lagos State were identified, where they said that there were regulatory challenges, there were regulatory gaps, chemical safety concerns were also raised, especially in the use of mercury, in the use of hydroquinone, corticosteroids, heavy metal, in certain cosmetic formulations. These were all raised in that program. Then we had the informal cosmetic practices, such as the mixing of skin lightening creams by some vendors, the distribution of unverified products through open markets and online platforms, and weak traceability systems. These were all noted. So the outputs from these situation analysis of Lagos State informed the development of a state cosmetic safety action plan. And that plan is at the stage of implementation presently. That is where we are. So all the gaps have been identified. The safety concerns that were raised were all duly noted. And so as a result, there was a situation, or as a result, there was an informed development of a state cosmetic safety action plan for the state. So presently, we are at the stage of implementing it. A lot of work is still going on. We plan to have advocacy visits to regulatory bodies and even to communities, to professional bodies also. We have the spa vendors, the beauty vendors. All these people are going to be carried along because they are all vital stakeholders in the implementation of the policy in the state. So that's the stage where we're in now. Thank you very much.
Thank you very much, Ma. And so we're hoping to have someone here from NAFDAC, but I think they were not able to join us today. But there's one very important thing, just a practical solution a practical example or scenario based on what pharmacist Madeleine spoke about and what you've spoken about. There are some gray areas between cosmetics and medication. For instance, you understand that some people have clobetasol propionate registered as a cosmetic, and this is a challenge. So is there any avenue by which we as dermatologists can, liaise with your portfolio as a cosmetics focal person to raise an objection against such a registration? Because clobetasol propionate is one of the strongest steroids, and for no reason should it be a cosmetic. Dr. Tahir Mohammed just noted that in the chat that it is registered as a cosmetic agent by NAFDAC. And when it's a cosmetic, it's not subjected to the very strict regulation, as we mentioned. And this is a challenge for us. So people buy clobetasol and use it for skin lightening. So can we share such feedback to you to feed into the national cosmetic policy that certain things that are registered as cosmetics should be removed or should not be registered as cosmetics because they are actually medications? I don't know what you think about that now.
Yes, anything that is that is a medicine, anything that has medical effects cannot be registered as a cosmetic. It has to be registered as a drug. It has to be registered as a drug. So definitely, yes, it will happen. It will be taken off, and we'll work in conjunction with NAFDAC to ensure that it happens.
Thank you very, very much, Ma. Thank you so much. I now want to go to the psychological aspect. As we know, skin lightening and skin bleaching, going beyond just cosmetics or physical, there are a lot of psychosocial there are a lot of psychosocial drivers, family influence, peer influence, social media, And so the last presentation for today, we're running a bit behind, but this is very important, is to talk about this. And so my dear sister and colleague, Dr. Bonjubola Abiri, who is a consultant psychiatrist, is going to be sharing a bit on this and also what we can do, what's the way forward, as regards the psychosocial and social aspects of skin lightening and skin bleaching. So over to you, Dr. Bonju.
All right. Good afternoon, distinguished panel members, senior colleagues, and of course, the general audience. Thank you very much for the opportunity to speak to the mental health aspect of skin bleaching. I usually say that as a psychiatrist, I rarely see patients who come to my clinic simply because they're bleaching their skin. More often than not, when they show up, it's largely because either they have a body dysmorphic disorder, there's psychological dependence on skin lightening products, or there's depression and anxiety that is rooted in the pressures of colorism and appearance-related stigma. But all of these diagnoses in my line of work tell only part of the story. Because more often than not, what I have found and what we found is that skin bleaching is not merely a cosmetic decision. It's a psychological and social response to powerful messages about beauty, identity, acceptance, and worth. And so today I want us to look beyond the skin, where I have to Beneath Your Beautiful. The song that I like by Labyrinth, it's Beneath Your Beautiful. The line in the song has always fascinated me. Won't you let me see beneath your beautiful? And so as a psychiatrist, I often wonder if this is the question we should ask when we meet someone who wants to change the color of their skin or who is already changing the color of their skin. Because skin bleaching is less about the skin and more about the story a person believes about themselves. As dermatologists and of course as public health physicians, when we treat the skin, we must also start to pay attention to the person living inside that skin. And so beyond what they present with, to be honest, sometimes we must really go above and beyond and ask that question, how are you really doing? How really do you feel about yourself? What is beneath this beautiful? Now, what are some of the psychological drivers that we've been able to identify? I want us to understand today that human beings don't simply see themselves through a mirror. We see ourselves through the eyes of society, how other people perceive us, feel about us. And so, number one driver, psychological driver, is identity. Many people grew up, even we grew up, being told that people who were lighter skinned were more beautiful, more successful, or even more desirable. Number two, self-esteem. When an individual's self-worth is shared or attached to appearance, changing the skin starts to look like, if I change my skin, how I can change my value and how I am perceived by people. Number three is social comparison. Social media has become a giant comparison machine. Filters, celebrity culture, and edited beauty standards are beginning to convince people that who they are is somehow not enough. And then, of course, there's a sense of belonging that is a psychological driver. Because bleeding is not always about beauty. Sometimes it's belonging. It's about wanting to fit in, wanting to get opportunities, and about wanting to be seen. And so what are some of the social drivers, a lot of which we've heard today? Behind every individual decision is often a collective story. Beyond what we see on the skin is a lot that we may not be able to pick out in that moment. And so colorism, media representation, advertising, peer influence, historical narratives, of course, marriage expectations, and workplace bias. The truth is that until we get people to understand that society has to change what it celebrates, many people will continue to try to change themselves. I know that has been said quite a number of times today. And so what are some mental health implications of skin bleaching? And so while these patients may not always present to me initially, what we find is that while they want to bleach their skins to become more acceptable, fit into society, unfortunately, it does quite the opposite. Low self-esteem, poor self-worth, body image dissatisfaction. The more they bleach, the more it leads to conditions or situations or circumstances that they need to use clothes and a lot of makeup to cover. It can also, of course, lead to anxiety, depression, social isolation, and stigma, psychological dependence on the cream, as in spite of the harm that the cream continues, or the mixtures or the injections continue to cause, they can't stop it. And so very often we always say that why people turn to substances, because in this case it can be termed a substance, it's a drug or a cosmetic, is that they're either trying to run away from pain or towards some form of pleasure. Last but not the least is that people who bleach their skin may be tempted to start self-harming, or may actually have suicidal ideation, or decide to end their own lives. What do I want to leave us with today? I want to leave us with hope. And that hope, of course, is contained in another song that I like very much, The Way You Are by Lighthouse Family. There's this line in that song that I also like. You don't have to change the way you are. You are beautiful the way you are. And so imagine if every child grew up hearing that message from their parents, from home, from schools, from churches, from social media, from traditional media, TV, adverts, all of those things, and even from us as healthcare professionals. We must understand today and every day that the greatest antidote to skin bleaching is not simply better regulation. It is healthier self-worth. When people feel healthier about themselves, when they resolve whatever the underlying traumatic life events or issues are, or the negativity that has been passed on from generation to generation, of course, via education, then they start to feel healthier about themselves. Now, as I close, I just want to encourage all the dermatologists who are very overwhelmed, and the public health physicians, and pharmacists and NAFDAC, that please keep your chin up. No one expected you to save the world. Otherwise, you'd have been born wearing a cape and tights. Just do the best that you can. Understand today and every day that healthy skin is important, but healthy self-esteem is also important. To protect the skin from harmful bleeding agents, we must also protect parts from the belief that people are only beautiful because they are someone else. Let's look beyond skin and encourage people to discover the beauty beneath. Thank you very much, and enjoy the rest of the conversation.
Wow, that was super inspiring and food for thought. And yes, we do need to, no matter if people want to find something, even with the strictest regulations, if they don't fix, the perception they have within, they're not going to win. People will always find what they want if bleaching is their decision or their resolve. So we need to also work on the mind, what people think, how they see themselves. And that's really powerful. Thank you very much, Dr. Abiri. And I'm really blown away by your presentation. I would love us to have a short Q&A, even though we're over time, but I don't know if there are any burning questions that we may want to share or comments. Please, if anybody has a comment or a question, just put up your hand and we'll enable you to speak. And I know that there's the chat, the Q&A section has been very vibrant. And thank you to Dr. Akikugbe, who has been answering most of the questions on the Q&A. So if you do have any further comments or question, perhaps we can just accept one or two before we close today. But I'm sure if we've been here from the beginning, we've learned so much. And going forward, we know that the work has just begun. We'll try to do it at our own pace, so we don't get burnt out, as Dr. Bonjo has rightly helped us to put in perspective that we're not meant to save the world. We're just meant to do the best we can, and so that's why we're having this webinar. So does anyone have any questions, comments, contributions? And I will just do a summary and overview if there are none. Okay, so I think everyone is probably, has had so much already and it's been a long day. And I'll just do a quick overview that this has been a very wonderful conversation about the challenge of skin lightening. We started by seeing the global landscape, and we also saw, from various parts of Africa, West Africa, East Africa, and South Africa. Prof. Glover also spoke about that. And the problems are all the same. People are using very harmful skin lightening agents, hydroquinone, potent corticosteroids like clobetasol, and also mercury-containing products, kojic acid. And now we have the IV glutathione and other IV agents coming into the mix. And it's going beyond just women. We're now seeing men and now children being involved in this harmful practice. And so there is a burden, rising burden in across dermatology clinics and practice, where there are already few dermatologists. The few dermatologists are now being burdened more with preventable conditions, as a result of skin bleaching and skin lightening practices. And so this is becoming a public health. I don't know if they're up to 40% of the population has high blood pressure, but we have in some places 40 to 60% practicing skin bleaching, and which will most likely lead to a myriad of adverse effects. So it really calls for concern as a public health concern. And so we're hoping that we can work together, with the public health physicians, community outreach, training of frontline health workers, working with regulatory bodies to tighten restriction regulations, and also working with the media and social media influence, advertising, film, so that we can improve our self-worth. At least I think it's a bit better now. Before, only fair people would be on billboards, but now you can still see some dark-skinned people on billboards or in television, but it needs to be a lot more. So that if young people see people who look like them, who have their skin color on the television being celebrated, they will not feel the need to be light-skinned for them to achieve that level of, celebration or popularity or love. And so we just need to continue to push for, in all aspects, in the clinical aspect, public health aspect, mental health aspect, social and cultural aspect, as much as is possible for us to do. Thank you very much for everyone who has been here right from the beginning. It's been a long 2 hours. I think there's one hand raised. Dr. Zainab Baba would like to just say one or two things, and then we call it a day. We'll ask Dr. Anaba. I'm not sure if she's on the call, but I think Dr. Akikube can also, and Professor Altred is also here for the final words. But before they come up, let me enable Dr. Zainab to say a very short, under 1 minute or less word. Thank you, Dr. Zainab. Hello. Dr. Zainab, you can unmute your microphone and speak. Okay, we're not able to hear you, unfortunately, but you could maybe just type in the chat. Yes, so we'd like to call on the Vice President of Nigerian Association of Dermatologists, Dr. Aisha Akikube, and the President, who are both here. Thank you for your support, sir and ma, as always. And we can have the final words and call it a day from you both.
Okay. Thank you very much for Lakemi. I hope I'm audible. Okay.
It's a bit low, but
yes,
okay.
Thank you to everyone, our panelists.
Better this time.
I'd like to thank all our panelists. The conversation continues. Thank you to each and every person that has joined in for the past 2 hours. It's really been interesting. The conversation will continue. And as Dr. Bonju has said, we can't save the world, but at least we'll try with the little we are doing. And honestly, we do need to keep the conversation going because, like has been said, our little children are being affected. So let's even leave the adults. The children are being affected. So if we don't do something, then the epidemic is going to continue. So thank you, everyone, and let's just keep this going. Thank you.
Thank you, Ma. Prof. Altrade, sir, have the final word.
Dr. Cole, thank you very much for this webinar. And like Aisha said, I hope the conversation will continue. And maybe the next one, you should invite the people from the Federal Ministry of Health, the Food and Drug Division. Like I said earlier, they had a workshop in October on cosmetic safety. I think the law is being enacted for the control of cosmetics. So I think they should be invited in the next system. And the problem is not just enacting the law. The problem is making sure that the law is obeyed. Thank you, everybody, for participating. It was a nice and fruitful 2 hours.
Thank you very much, sir. We're also putting together an advocacy toolkit, which we'll send to all the webinar participants, which can be used to advocate, and we can share it with primary care workers, public health physicians, to be able to talk to people and also to be able to recognize the signs of skin bleaching at an early age. And that toolkit will be very helpful and tell you how you can counsel people. And, when you're telling them, don't do this, what are they supposed to do? So hopefully you'll be able to get that as, attendees of the webinar. It can be useful for those who work in the clinical aspect and even the public health aspect. So thank you once again to all our panelists, our attendees, speakers. Thank you so much. And like we say, the conversation continues and we have more work to do to be able to, help our community and our society. All right. Thank you and have a blessed weekend or week, everybody. And happy World Skin Health Day. Bye for now.